Good morning and welcome. I always love when we have a sunny day in Washington, D.C. when the metro is not working and we have a full house. So welcome to the Wilson Center. I'm Roger Mark D'Souza, and I direct our programs on global sustainability and resilience here at the Wilson Center. And we're very, very excited to welcome you to today's discussion on hope for sustainable development results from integration in East Africa. And those of you who are familiar with the Wilson Center know that we serve as the living memorial to President Wilson, bringing together analysis, policy application, and opportunities with programmatic innovations on the ground. And those of you who have attended events here at the Wilson Center would have walked into this room and said, this setup is a little different. And that's deliberate because today's event is different from what we normally do here at the Wilson Center. And for the invitation, you would have seen that the first line invites you to join us for a rare opportunity to meet the field team from the Health of People and Environment in Lake Victoria Basin Initiative to learn firsthand about their work supporting communities and governments in Kenya and Uganda to achieve the Sustainable Development Goals. Those of you who have been involved in tracking the SDGs know that the SDGs very much is about integration, so that is the focus of our discussion today. Some of you may be aware that the Wilson Center was most recently voted by the University of Pennsylvania as the #1 think tank globally for transboundary research, transdisciplinary research. So this idea of integration very much is at home here at the Wilson Center and very much at home with this project. I was recently listening to some commentary for the recent conference on the focus on women here in Washington, D.C., and one of the commentators said that we need to be very careful about representation, that when we talk about other communities or projects, that we need to be able to pass the mic to those people who are on the ground, who are at the forefront of this work, and who are the innovators. So I'm very excited today that we have the opportunity to pass the mic to our colleagues around the Lake Victoria Basin who are doing this work. And I'd like to start by asking my colleague, Pamela Onduso, who is the Senior Technical Advisor on Youth Advocacy and Partnership at Pathfinder International in Kenya, to kick us off with some opening remarks. Pamela has 25 years of experience in senior positions working with development organizations, public sector ministries of health, education, planning, and youth. And with the private sector, she's worked with corporations and foundations such as Barclays Bank, United Way, Citigroup, Ford, and Rockefeller Foundations, and has worked in a number of fields, including family planning, reproductive health, maternal, newborn, child and adolescent health, and population health and environment, working on resource mobilization, design, management, and policy development. So Pamela, welcome, and I hand it over to you.
Thank you. Distinguished guests, ladies and gentlemen, all other protocols being observed, good morning and welcome. We'd like to begin by thanking the United States Agency for International Development and the Evidence to Action Project for the opportunity to present here today and for supporting the work that we've been undertaking. We'd like to start the session by showing a clip of a longer video. This will be followed with a short presentation. Thereafter, we will have an interactive discussion with other members of the HoPE team and field questions from you, the audience. The film you're about to see was produced in late 2015, a year into the scaling up process, which will form the basis for much of my presentation today. So if we could please have a clip of the film. How long is your clip?
5 minutes.
Okay, because I think we only have
Something remarkable is happening in the Lake Victoria Basin. Here, communities have realized their well-being is dependent on a vibrant ecosystem. And so, they have adopted an innovative strategy which integrates population, health, and environmental issues to restore and protect the integrity of Lake Victoria, the golden treasure shared among Uganda, Kenya, and Tanzania. To many, this strategy is popularly known as the PHE approach. The approach was introduced as a pilot in 2011 under the Health of the People and Environment in Lake Victoria Basin project, also known as HoPE LVB. It is a regional project designed to reach across country borders to address the region's interrelated challenges. The PHE approach empowers families within the Lake Victoria Basin to simultaneously demand and access voluntary family planning and sexual reproductive health services, while at the same time adopting cost-effective, affordable, and sustainable ways of managing the natural resources on which they depend, because they easily understand the interconnected relationship between their economic and cultural interests, both in the short and long term.
And Kanyo Kakayang Mother, a HoPE LVB project.
I am a young mother working with the HoPE LVB. Before the project came, we had already produced 4 children, barely spaced by a year in between. The family was very poor. I and my children used to be very sickly. PHE has helped us a lot because we agreed with my husband to start planning for our family. That is why our 5th born came 3 years later. We are happy and we have been able to start farming. We now have enough food and surplus for sale. That is how we raised the money for starting this retail shop. And we are also trying to care for the environment. I have shared my experience, and already 2 of our neighbors are also considering to start family planning and to plant trees. So I can proudly say that I'm also a young champion.
None of these changes would have been possible without the commitment and creativity of the leaders and policymakers who supported the initial rollout of HoPE LVB activities and paved the way forward. PHE champions are advocates for an integrated approach to sustainable development. These champions, women and men, educate their fellow community members about the benefits of the PHE approach. Their strong communication skills allow them to raise awareness about PHE and to advocate for adopting the approaches in other communities. The PHE champions also adopt PHE activities in their own households and communities, becoming models for others.
We are working with 7 groups: the women group, the model household, the CFW, the youths, the young mothers, and the farmers. Initially, we were only dealing with the health component, but after the intervention of PHE, we decided to integrate the 3 things: the population, health, and environment. So as a business lady, I'm running an M-Pesa. At the same time, I have a boutique. So as you know, many people are popping in. So in that, I have a good time in teaching my PHE to them. I'm happy because I have the knowledge and I'm sharing it with others.
A lot of people have accepted the use of EcoSan toilet because of this message. I count that as a milestone. And again, people are also embracing the use of the energy-saving Jiko. And then people are also trees because of this PHE integration. And I can't exactly tell where the boundary is between my day-to-day work as administrator and the work of advocating my life. To an extent that I talk about it in any gathering, or I talk about it with anybody that can listen to me.
PHE champions also travel to other districts or counties to advocate for PHE. By sharing their knowledge and experience, they improve government officials' understanding of the benefits of the PHE in solving the interconnected development challenges. They can encourage the officials to adopt policies and laws that promote an integrated PHE approach and to consider ways to scale up PHE in their jurisdictions and beyond. Something remarkable is happening in the Lake Victoria Basin. Here, communities have realized their well-being is dependent on a vibrant.
There you go. Now we go back. Next. Yes. Now we'd like to go next. Thank you. Just to make sure that everyone understands what we mean by the PHE concept, because we'll be using this acronym throughout the session, PHE is an integrated approach to improve access to health services, especially family planning and sexual and reproductive health, whilst at the same time helping communities to manage natural resources and conserve the critical ecosystems on which they depend. This approach is anchored in and is helping to achieve the Sustainable Development Goals in East Africa, the East African Community Vision 2050, and East African Partner States country visions and national development plans, as well as FP 2020, a global initiative to address unmet need for family planning. Since 2012, the health of people and environment in the Lake Victoria Basin, otherwise known as HoPE LVB, has been working to model and then scale up the promising cross-sectoral PHE approach to address the interrelated challenges faced by marginalized rural communities in the Lake Victoria Basin regions of Uganda and Kenya. These challenges include food insecurity, weak health infrastructure and services, environmental degradation, high maternal and infant mortality, vulnerabilities to climate change, inadequate water, sanitation and hygiene, high unmet need for family planning, gender inequality, and lack of economic or livelihood opportunities. With reference to the slide that you see before you, the total target populations in Uganda are roughly 92,000, and on the Kenyan side, 40,000. The first or pilot phase began in 2012 and ended in 2014. We're currently in the second phase, which is known as the testing scale-up, which began in 2015 and ends next year in 2017. HoPE is being implemented by Pathfinder International as the lead agency, working closely with local environmental organizations. We are funded by the United States Agency for International Development, the MacArthur, Packard, Barr, Swift, and Winslow Foundations. The HoPE LVB initiative is now working in the scale-up phase in 2 districts in Uganda and 2 counties in Kenya. Unfortunately, we will not have time to go into detail about many aspects of the HoPE package of interventions, since this particular presentation is focused on the scaling up experience and how this promising approach can help achieve the SDGs more rapidly. However, you are most welcome to ask questions to the distinguished panel of field staff seated beside me, as well, to read more about the initiative and the tools that we have used during implementation, which are located at the back of the room. The next slide looks at how HoPE's PHE integrated approach represents a promising strategy for implementing the Sustainable Development Goals in East Africa. By our humble analysis, the HoPE approach addresses 15 of 17 SDGs. We'll look at two. SDG number 5, which is focused on women's equality, where HoPE addresses women, especially young women's economic opportunities and their sexual and reproductive health and rights. For example, improved contraceptive method mix and high uptake of family planning and facility-based delivery, especially by young mothers, leads to women having more opportunities to become economically active and participate in decision-making about natural resource management. A second example is to look at Sustainable Development Goal number 15, which deals with life on land in terms of sustainable agriculture and sustainable management of forests, fisheries, and wetlands. In HoPE LVB communities, 70% of households now practice agroforestry, mulching, minimum tillage, terracing, composite manure, and water conservation. This has increased crop yields and improved food security, as well as generated household income. The PHE approach, ladies and gentlemen, advances the conversation about how multi-sectoral programming and multi-sector partnerships are critical to the success of the Sustainable Development Goals. The SDGs are interconnected and none can be addressed in isolation. Our experience to date has shown that increased understanding of how PHE links to the SDGs, especially among decision makers and funding partners, has led to PHE gaining the position of an appropriate response to sustainable development for the East African community. Governments at all levels, from local to regional, are embracing PHE. For example, in September 2015, the Lake Victoria Basin Commission, an arm of the East African community, convened a regional PHE conference with funding from the United States Agency for International Development, where the 5 partner states agreed that PHE helps meet at least 11 Sustainable Development Goals and adopted PHE as a means of achieving the SDGs. Now, the East African community has a regional PHE strategy, and each of the 5 member states is finalizing its own national PHE strategy. Next. In order to achieve the SDGs, we need to design projects that are scalable. With technical support from ExpandNet, the HoPE LVB team has been applying the 12 recommendations contained from the guide, beginning with the end in mind, from the earliest stages of project design and throughout implementation. This approach has helped set the project for success with scale-up. After the model was proven successful, we proceeded to organize scaling up strategy development workshops in both Kenya and Uganda, bringing together a wide range of sectors and stakeholders to generate political will and buy-in and recommendations for how to scale up the approach more widely in both countries. Next. This slide helps conceptualize the scaling up trajectory, as well as how the HoPE phases map to this process. It shows that ideally, a project would be designed taking into consideration the determinants of scaling up success, using the beginning of the end in mind guidance or other resources. HoPE's first phase was intended to design and test a scalable model. HoPE then moved on to phase 2, which began with the development of a scaling up strategy, as seen in the graphic. Then, very importantly, one needs to work to strategically manage the scaling up process, because without a guided process, we know that nothing much happens. And it is this stage that HoPE is in right now. Of course, much more needs to be done in order to support the further institutionalization and expansion of PHE more widely in Uganda, Kenya, and indeed East Africa. A key principle of scaling up is the need to design and test a project for the system that is supposed to adopt and implement it on a larger scale. This statement, shown on the slide, captured during the project's midterm review, illustrates how the project did not set up its own parallel or vertical structures, but rather worked with existing systems that would extend beyond the life of the project. And as such, the capacity built would remain and be well positioned for expansion. The project's explicit focus on advocacy and scaling up has led to many successes, and we'll begin by looking at the scenario in Uganda. One example is how, after the Ministry of Health in Uganda, having attended the strategy development workshop, adopted the model household concept within the government's community health extension worker strategy. The Ugandan government is currently using the HoPE LVB model household selection criteria to select model homes. A second example, still in Uganda, are the two districts where HoPE is working in Uganda, Wakiso and Mayuge, where both have opted to create their own model villages in more accessible locations as an outcome of the project's efforts to begin with the end in mind. This is a great example of what happens when local government feels ownership of interventions. The integrated team at the district offices includes reproductive health, and natural resource officers working together with the chief administrative officer and others. The team is using mostly its own capacity and resources, with minimal technical support and facilitation being provided by the project. Local community-based organizations are adopting the HoPE approach with technical support from the project. Lastly, there's a new climate change policy in Uganda that gives special attention to PHE as part of the results of HoPE project initiatives. Moving over to Kenya, we also have examples of key outcomes of advocacy and scaling up work, which include the establishment of a government-led PHE steering committee in Homa Bay County in the first phase, and subsequently in Siaya, an expansion county in phase 2. Homa Bay and Siaya counties have both incorporated and budgeted for PHE in their 5-year county integrated development plans. Lastly, there's been a joint HoPE National Environmental Management Agency, NEMA, funded concept note that incorporates PHE into green initiatives with community-based organizations. Roughly $100,000 was received, and HoPE is providing PHE technical assistance to community-based organization grantees. HoPE's efforts to share learning on systematic scaling up. Sharing learning from HoPE with PHE stakeholders in Kenya and Uganda and around the East African community has always been an important activity for us. The development of a toolkit to support others to successfully replicate project interventions is ongoing. A 2014 Reproductive Health Matters paper, which discusses in more detail how the project began with the end in mind, is available for your reference at the back of the room. All through, technical exchanges have played an important role in allowing stakeholders to see the project in action and understand the results of PHE implementation. In addition, Pathfinder International is continuing to build on its Memorandum of Understanding with the East African Communities Lake Victoria Basin Commission, which has led to partner states adopting PHE into the East African Community PHE Strategic Plan. In addition, strong advocacy is being undertaken by the Lake Victoria Basin Commission and the East African Community PHE working groups to replicate HoPE approaches in other ecosystems beyond the Lake Basin. HoPE's learning on integrated PHE implementation and on scaling up has been incredibly rich. In particular, how organizations can work towards scale-up from the early stages of project design as well as throughout implementation. Having an explicit focus on systematically planning for and strategically managing the scaling up process was critical to achieving the gains that we have presented here. The HoPE Initiative's PHE integrated approach is a highly promising means to achieve the SDGs. Our contribution to the field is that we hope PHE stakeholders like yourselves and projects around the world will benefit from our learning. We would like to recognize the many implementing partners and collaborators and funders who have supported our multi-sectoral approach and helped us to focus on future scale-up since Phase 1, some of whom are present with us here today, as indicated on that slide. Finally, ladies and gentlemen, thank you for your entrance and thank you for your attention. Good morning.
Thank you very much, Pamela. I think that's an excellent introduction and overview combined with the film that really gets at the heart of integration and scaling up in a very purposeful and deliberate way. And I think, you know, at a very high level, we talk about integration, but this is an opportunity to see some of the ways that that is being implemented on the ground. So before we go to the panel and hear from some of your colleagues, Pamela, I must ask you, given your background and experience with the corporate sector, the corporate side of things, based on what you have presented and your experience, what do you think are some of the key selling points for this approach for the corporate sector, for the private sector? Because this is an issue that the PHE community has long struggled with. So, and we didn't plan this, so forgive me. What are some of your thoughts and reactions? You've just spoken very eloquently about this work. You have worked with the corporate sector. Can you help us bring the two together?
Yes. For the corporates, for example, in Kenya, we have Safaricom, and we also have many of the banks, Barclays Bank, Citigroup, and others. Our selling point has been that if we can have their employees contracepting and therefore managing and spacing their families and managing their family size, they are more likely to be able to become better employees, and at the same time, because they will be healthier, their wives will be able to spend more time in the workplace and give more time to their families, and that at the end of the day, a healthier, happier employee is more likely to be at work more often than taking time off, dealing with issues around illness, issues around poor water and sanitation in the workplace, because they can afford to live in better environments and maintain their environments in a better way. And so for us, the point is, it makes sense. It's a best buy.
Great, thank you. So there's a real business case here to be made. So thank you very much. That was excellent. So I want to really pass the mic on to our colleagues from the region, and I'm going to start by just giving it over to my colleague Laura Guron, who's the Vice President of Partners in Expanding HealthNet Quality and Access, and she serves as a member of the ExpandNet Secretariat also. So Laura will moderate the discussion with our panelists. I hope you do a very quick, brief introduction of who we have here, but also a couple of our colleagues who are in the room with us. So, Laura, I'd like to hand it over to you.
Great. Thank you, Roger Mark. Let me actually let my colleagues introduce themselves because we also have 2 team members from the audience, too. So, Dora, will you start us?
Yes, please. Thank you. Good morning. I'm Dora Taranta. I work for Pathfinder International Uganda office, and I lead the small team in Uganda that works on the PHE approach in the Lake Victoria Basin, as Pamela has presented it to us. Thank you.
Good morning, everyone. My name is Antonio Mimo. I work for Pathfinder International. I'm based in Kenya, in Kisumu, at the edge of Lake Victoria. It's a small town. So, thank you.
Good morning. I'm Charles Kaviswa. I work as the Programs Director for a conservation organization called the Ecological Christian Organization. I'm based in Uganda, but I also represent our counterpart who are part of this project from the Kenyan side, that is Nature Kenya, sorry. And I'm happy to be here. I've been part of the HoPE LVB project right from start. Thank you.
Hi everyone, I'm Millicent Kodande. I come from Pathfinder International Kisumu office. I work as a monitoring and evaluation officer, also assisting program activities. Thank you.
Good morning everyone. My name is Caroline Naroga. I work as the monitoring and evaluation manager for Pathfinder Uganda on the HoPE project, and I support monitoring and evaluation for both Uganda and Kenya on HoPE LVB. Thank you.
Mm-hmm. Thank you, everyone. So now you know who the team that's representing more colleagues back at home who are here with us today. And after this panel interview, we'll have a chance to sit in small groups and you'll be able to engage in dialogue directly with the team. But first, we'd like to draw out some of the interesting learning that the project has had above and beyond everything that you've heard already. We'll build on that. And in doing so, we'll get to hear some stories about what has been happening in the field, what the team is learning about scaling up, about implementation of PHE, etc. So let us start that interview with Dora. Can I ask you a question first, Dora? Maybe it would be helpful for the audience and those who are listening from a distance if they could hear a little bit more about the design of HoPE LVB, and in particular in its first phase, about the design of the first phase, how that helped lay the groundwork for the success that we've had with scaling up to date.
Yeah. Thank you, Laura. Pamela already has given us an overview, and I'll just pick out the key aspects of our design. Like she mentioned, we started our design thinking of scaling up in future. So we started thinking about the end in mind. And some of our key aspects that informed this whole journey from pilot to scale up included us looking at key partnerships from the start. We're looking at we're here to implement, but who are the key allies, who are the key partners that we need, both for implementation, but also for sustainability, which brings in partnerships from the government side, partnerships from the civil society organizations, and like she already put it up, we had to look at, as Pathfinder, we knew we needed the environment organizations who are going to boost up our interventions. With our partners set and the ground set, we moved into conduct a baseline and then the scoping exercise. And this helped to inform, what exactly we're going in for. In most cases, we write our projects as we are looking for funding based on what we know, but there is much more that the communities have that sometimes we do not have. We know what they need, but they know their needs best. So we conducted that and we were able to come up with the needs that they have but also engaging them to help us design, think through the interventions, but also tease out what will work for them and what they are willing to work with us throughout the project life. So that was a key aspect for us, combining the baseline to do the assessment, but also bringing the community on board to be able to design and define what they want in the interventions that we're going to carry out. Moving from that, of course, we needed these communities to be able to speak out for themselves, but also to carry the idea and move it on through a pilot to scale up and for sustainability. So beyond the needs, we also engaged them in defining and drawing what they want to see the future. That way, they were engaged in drawing what we called the vision maps. From the community vision maps, they drew what they wanted to see at home. They put it down in writing, in pictures, and we took it up. And that led us to our other key aspect, which was the interventions at the home setting, which we refer to as model household setting. That is a very key aspect for us as a project because it is difficult to measure behavior change. It's difficult sometimes to get to see the changes in the different behaviors and practices, but at the household level, we're able to see what these households, what these individuals, what this home is doing to change their lifestyles, what they are doing to preserve the natural resources that mostly they depend on, what they are doing to improve their health, and what they are doing to promote what they have learned. So to us, that was a key aspect to move on, and it's one aspect that we have taken on, and as Pamela mentioned in her presentation, the government has taken it on in one of their key strategies. Moving from the homes, and now knowing what they need, still we did not start up new systems or new groups. We moved in to work with what was already existing. So we looked at how do we improve, strengthen the systems, how do we empower these women and men, how do we bring youth on board, how do we work with public health facilities, how do we build partnerships between public facilities and private facilities to make sure that we have a comprehensive package, but an enriched package that is going to benefit the communities. So we set in and built systems, and until a point where we realize that, yes, the communities are able now to move along and move alone. So we brought them in and trained them in supporting other community members that were not so welcoming at the beginning, but along the way started realizing that it was really beautiful to be part of this community, this new movement. And then we built up what we call a resource team, or resource teams in the communities. These are community members in their different groups. We have groups like women groups, we have fishermen groups, youth groups, young mothers groups, and farmers groups, besides the health groups that we mostly work with as a health organization. So the members from those different groups picked themselves out and they said, I'm giving out my time, I'm willing to teach another home, I'm willing to teach another school, I'm willing to go to the school and talk to these young girls and boys about their reproductive health, about the environment, and about their future. So pulling all that together, we were able now to say, yes, we can move, and we have been moving. A key aspect to mention here is our advocacy efforts. From the beginning, we realized that previously, as health, as environment conservation organizations, our advocacy had been from the top. So now we built in our advocacy from the community. As we strengthened systems and supported communities, we started looking at what is it that they have that they haven't used, that they can use as a voice to demand their rights, to demand for services, and to move their lives from where they were to a level that is more enriching. So we built into that component from the ground which to us we call the community advocacy efforts. Yeah. Thank you.
Thank you, Dora. That was incredibly enriching for us as a backdrop for all that Pamela presented. Thank you. So Anthony, maybe now I can call upon you to help us understand and elaborate a little bit on how your application of a systematic approach to scaling up, how did that lead to some of your early success with scaling up? Can you shed light on that for us?
Thank you, Laura. I want to build on what Dora has just talked about. And I would like to outline that whole project from the beginning was started with the beginning with the end in mind. So the design was such that we will scale it up, and that was guided by the expanded tools, the expanded WHO tools, that systematically took us through from the beginning of the implementation throughout to where we are. And in that regards, some of the key aspects of what we did, I would just like to highlight. First is the establishment of structures, because we wanted to institutionalize the PHE approach as a system in the government. And in that regard, we supported the establishment of a PHE steering committee at the county level or the district level, which brought together different sectors into one common meeting to discuss issues that relates to PHE. Also, we started by identifying champions at the early age at different levels. From the community, we identified those people who would be on our side in terms of furthering PHE at county, at national level, and at regional level. That was key to some of the early successes. Based on that, we also did a capacity building to these people that we realized were going to be part of the team that are going to support PHE approach. So capacity building to most training of the community groups that Dora talked about, the young mothers, training of the beach management unit, which are a fisher organization, the farmers, and all the rest of the groups that we work with. So this was very key in terms of making us realize the early successes of the HoPE project. We also started to identify the key allies around, like, because now the champions had gained much of the information and also were confident to pass the same to other organizations. HoPE project started to support others, community-based organizations, to implement the HoPE model, which was very key to some of the scaling up process that we just began as per the presentation. So key amongst that were, if I'm just to go back to what I've said, was the establishment of the steering committees, establishment or supporting the champions at different levels, working to support community groups, to capacity build them, to understand and come up and support the PHE approach, and also work with other organizations that already shown interest in taking up this approach. But all these were courtesy to the systematic approach that were applied from the beginning, with the starting at the beginning and end in mind, to make sure that we succeed. Thank you.
Thank you. Of course, advocacy is a critical part of scaling up and plays a critical role in all aspects of taking a systematic approach to scaling up. So thank you for sharing at the county and local levels to Dora and Anthony, but may I now ask you, Charles, if you could share some insight about the national and regional level movement that's happening for PHE? I know that Pamela presented some of this, but maybe you could tell some stories about what's happening there.
Thank you, Laura, and of course, Pamela gave a lot on that. I will only just give key highlights.
Yeah.
And as you all know now, I think that we were very keen on integrating advocacy, and it formed one of the key standalone objective, cutting across all our interventions. So we never wanted HoPE to remain alone there hanging. We wanted it to be carried on, and that's why thinking of sustainability right from start was key. And the end on that was to make sure that this good, promising approach is institutionalized within the different levels, and because our working was to analyze the key stakeholders of who are the user, who would be the future use of this approach. We looked at the communities we are working with, local level, we looked at the district, then we identified the stakeholders at the national level, different sector ministries, and also we also looked at a higher level target because we wanted it to be transboundary, and that is targeting the East African community. So we targeted the institution of Lake Victoria Basin Commission because that was primarily our target area or scope. And I'm happy to inform you that within a short time, we have registered good results at all levels. At national levels, districts, those local government units are replicating the model on their own. They are planning together, different sectors coming together and planning and actually allocating some budget. We have got population health and environmental champions right from the villages and to the district. We have heard stories from Mende, replicating communities in Wakiso district, that is at district level replicating. Then I think examples from Homa Bay that Pamela presented about how they are integrating the same into their plans. But I think the key highlight is at the national level, where we have in place what we call population health and environment network. Those are PHE national networks. Mm-hmm. And all the countries, the two countries, Uganda and Kenya, they have come up with what we call country PHE strategies. Of course, Pamela mentioned that. And it hasn't ended with that. We have all the partner states within East African community, that is Uganda, Kenya, Rwanda, Burundi, Tanzania, and I think, all the 5 partner states have developed the strategy, and that means those are supportive structures and policies or frameworks that can support the expansion of this promising approach in the entire region. At the East African community, we have already noted there's a regional PHE strategy in place, and these are very, very notable, results. So at even some policies like the climate change policy for Uganda, as Pamela mentioned, I think these have been so tremendously informed by the HoPE LVB project. It's not easy within a short time to have those important results on paper, especially at the institutional level. Maybe it might be easier in Washington, in East Africa, with some politics, not so easy. And I think this is too much for us, and it is a much accepted, and the conviction and the belief that this is the way to go if we have to meet the targets of 2030 of the SDGs within East Africa, but also partner state country visions and the short-term development plans, and maybe FP 2020. Thank you.
Mm-hmm. I always remember back how when we first walked into the Lake Victoria Basin Commission in early 2012, and we were together, and at that point, it was what Dora was referring to as our scoping visits, and they had never heard of PHE, and now they've come so far as to be facilitating a multinational process of gaining energy and momentum behind the implementation of PHE strategies in all 5 member nations, as Charles was just saying. So maybe now let us turn to some of the results so that the audience can hear a little bit. Of course, this project has sector-specific results in family planning, in maternal and child health, in environment, but we're not going to go into those in much depth right now. We can do so more in the group work, but maybe for the benefit of this session, we could call upon Dora, if we could, and ask you, Dora, to reflect on why an integrated approach might in some cases be preferable to taking a more vertical sector-specific approach to the areas of need that we've identified.
Sure. Yeah, thank you once again, Laura. I want to build on to what the rest of the team have already said. And sometimes you might wonder why in such a short time, like Charles is saying, are we seeing, the institutions taking on PHE? It's basically because of what they have seen on ground. We have, enticed them, encouraged them, and sometimes supported them to come to the field to see what is happening within the communities. And what they have seen has informed a lot of what they're doing. One of our key, should I say, achievement or the beauty of integration is because we have managed to bring together the different sectors at the ministerial level, at the local government level. We have been able to bring ministries of health. We've been able to bring health departments, environment departments, population departments, natural resources, to come together and think about what is the best way for them to reach the communities they serve. And that is why they come back, they're able to say, let's try to replicate it in a place near home. So to me, that is it's a very key achievement for integration. We're meeting as the same group of people. Instead of going there 3-4 times, they go there once, and they are achieving what they would have achieved in 6 months. They're achieving it in probably 1 or 2 months. So that is, very convincing for them to go the integration way. But also, for the communities that we serve, we have seen empowerment, especially for the women, for the girl child, as a result of these integrated approaches. We have seen women who used to think that their role was only in the kitchen and giving birth, coming up and starting to participate in income-generating activities because we've supported them to strengthen the systems within their groups. And they are now looking beyond meeting to talk about, men used to think that they will come to rumor-monger. But with time, they realize that actually when they go, they are not rumor-mongering. They are talking about issues affecting their reproductive health. They are talking about issues that are affecting their incomes at the household. They are talking about issues affecting the environment. And from those meetings, they have been able to come up with what we call environmental-friendly income-generating activities. And which man in this room wouldn't want a wife who is able to support them, to bring in an extra income? A wife who does not ask for a matchbox, ask for a knicker, ask for everything. I think every woman would be very pleased. And that is the beauty of integration that we're seeing in the communities. Besides that, partnerships, like I talked about in the beginning, have been very, very key for us. We realize at all levels, actually, we realize that an individual or a group or a department cannot reach the needs of all that we serve. We need partnerships. We need to work together. We need to hold each other's hand. And that is what PHE calls for, partnerships. And those partnerships are the ones that have seen us move from pilot to scaling up. And we are looking at sustainability with the very many key, strategies that are coming in place to promote integration. Yes, one key important beauty, or I like calling it beauty of integration, is male involvement in health and reproductive health. I don't know how it is in Europe and America, but I know in Africa, health and reproductive health is an issue for a woman. But with PHE integration interventions, we have seen men come up, because when we work with a fishermen group and we talk about how family planning is related to them preserving the fish breeding zones in the lake, then they are looking at, yes, I'll have more fish, I'll have more money. Everyone wants money, but I think men love more money. So they want to see how much money they are going to get out of their activities. And in this way, they are looking at a conserved breeding zone that in maybe 6 months will bring in bigger fish, which means more money, and from there they are now relating it. When we are talking to them, we relate that to the health of the woman. And we're saying if your wife can plan her pregnancies, space her pregnancies, she'll be healthier, she'll support you, your children will be happy, you'll go back to a happy family. You're not going to go back to a family where children are crying all over the place and you don't even want to get home. And these men have accepted and bought into the idea. They are now our voices. They are our champion. They are promoting family planning. If time would allow, would have shared with you the many photos, pictures that we take. And these men are now escorting their wives. They are planning on deliveries in the facilities because they want the wife after delivery to go for family planning. These are some of the few I can share with you about the beauty of integration. Thank you.
Thank you. Can we also call on our colleague Millicent, who's an M&E advisor, but also plays a very critical role in programmatic implementation in Kenya, to also augment the responses of Dora?
Thank you, Laura. I would like to add on to what Dora has just said. We have seen our communities able to demand quality services from their government offices. Previously, the communities depended on the projects that come and go. But because the communities have been empowered, they understand that the county governments, the districts have a right to provide infrastructure and to provide facilities for their own development. We see fishermen demanding better roads for their fish to get to the market. We see women demanding that their facilities, and especially maternities which were not better furnished, that they must be furnished, and they're demanding for these services from the county governments, not necessarily depending on the projects. We have also seen our communities, like the women, demanding better services for the groups, women groups which are formed, to get more facilitation in financing for their community groups activities, which was previously dependent on projects which come and are implemented and go.
Thank you, Millicent. Those very helpful examples. Maybe now, in the little time that's left, Charles, can I maybe call upon you as our ecological Christian organization partner representing environmental conservation? Can you share with the audience a little bit about how this HoPE approach that we've been discussing this morning, how does it contribute to community resilience and to climate change readiness and food security, any other civic engagement, whatever you'd like to add in our final remarks?
Laura, thanks for the good question, and I think the people who are listening and the great group that is represented here, we all know that for community resilience to happen, I think we all need to use what we call multidimensional approach, because just sitting comfortable in our sector seats cannot lead to resilience. So you need a number of more of an holistic approach, which is the opportunity that the PHE project, or HoPE LVB, has provided to the communities. You need the healthy families, so you have to have healthy interventions. You need to build their community capacities to adapt and also set up rights-based approaches. Most of these may be climate change adaptation measures. So our project has been offering this, building community capacities, but also trying to put in place a participatory or key measures that the communities agree upon, especially when it comes to food security, and we do sustainable farming practices. Someone already, Pamela, has given you the highlights, and actually the other graph, the other drawing of the SDG linkages comes in pertinent with this kind of discussion. We need to have sustainable fisheries practices so that you conserve the fisheries and also the lake or any other ecosystems for the general ecosystem and the people to be resilient to the effects of climate change. And we see families building up, because as most of you might be aware that our approach goes in much into looking at a family unit at household level, having all those cross-sector approaches demonstrated within a home, but also each home learns from the other, and there's a high multiplier effect. I think right now we have over 1,000 such village-based homes that are modeling the population health and environmental practices, including these aspects that we are talking about, the resilient measures at village level, and there's a higher multiplier effect, so one wants to learn from the other. So we even the focus on women and children as part of this project has been key, because we are looking at who is most at risk for these climate shocks or any possible disaster, and then making sure that the children and their homes. So still issues of child spacing are very critical, because if you are like a pregnant year in and a year out, I think many times you are likely to be prone to the weaknesses. You can't work hard for the food at home, and a number of issues, spending much and the energy, and all these we bring into consideration when we are looking at the community to become resilient. So this is very, very, very pertinent when we are working within these communities.
Do you want to give any examples of some of the environmental interventions? Because I don't think we've heard about those much this morning.
Yeah, in terms of the environmental interventions, our project basically works on sustainable agricultural practices. We promote agroforestry, tree planting, more or less conservation agriculture, and also we do conserve the fisheries sector, or co-management of the fisheries, especially when it comes to working with what we call beach management units. These are fish leaders within the fish communities. And we protect the fish breeding areas. Those are spawning areas that have actually increased in our communities, doubled the catch for fish. This has got significant impact on the food, on nutrition, and it has got a lot of impact in terms of incomes for the people. But also we have communities have developed what we call community bylaws to conserve all these interventions that we are putting up, especially conservation measures. And we also have opportunities that the conservation local groups at the same time is promoting family planning messages. So we have got the beach management unit also serving as village health teams. The village health teams are the community health workers. In our country, they are the health center one at village level. So they are cross-cutting. They do messaging and also do the fishing at the same time. So planning for families and the farms and the fisheries go together within the basin, especially in these locations. And it's quite very interesting with some significant changes that we see on the ground.
Thank you. I thought you might, I know we have to end, but I thought you might talk a little bit about the energy-saving stoves and how, but I'm going to invite Dora to talk about not only how energy save the construction, teaching community members to construct them as a skill, as a trade skill, and thereby being able to generate funding, but also what some of the results, the value-added results of energy-saving stoves in the home might be, so that people can end on a story note.
Okay. Thank you, Laura, but allow me pass it on to someone who's going to give us a story about how now the men are happy to come into the kitchen and talk to their wives because there is no smoke and there is reduced dust. Millicent, please.
Thank you, Dora. Energy-saving stoves are modeled and they're constructed by the women. Initially, it was a women's activity, but the men also joined the groups that are constructing energy cook stoves. These energy cook stoves use a single or 2 pieces of firewood for cooking in the kitchen, have less or very limited smoke in the kitchen, and is more efficient for use at home compared to the traditional 3 stones that were used. When the project introduced the energy cook stoves, so many women adopted it because when you have fewer wood fuel, you're still able to cook food for your family. There is less indoor pollution at households. We have a story of a man who never came back home earlier because whenever they were cooking at home, there is a lot of smoke and he would prefer to stay away and come home when food is ready. Right now, as we talk today, this man stays at home because they have a separate kitchen through the model household approach, where we encourage households to have a separate cooking space. He helps the children to do homework as the woman is cooking in the same kitchen, because there is also improved lighting in the same kitchen. And this is very interesting because this has improved communication at home. There is a better relationship as compared earlier, because the man could only come home to eat and sleep and not to see what the children do. But right now, he's more interactive with the family. He's following up on their homework and also ensuring that when the woman is busy getting water or doing something, he's also helping in the cooking. And it is a very interesting story. Thank you.
Great. Thank you, everybody. I think now maybe we'd like to open the questions to the audience for a few questions before we break into groups. Right, Roger Mark?
So what we'll do is we'll take just 2 or 3 questions, and then we'll have some comments and reactions from our colleague Paula Caballero, who will also talk about some of the work that the World Bank is doing in this area. So let's take 2 or 3 questions, and then we'll take it from there. And I'll ask you to please give once again, this is being webcast live, it's being recorded, so we need to get your name and affiliation and get quickly to your question, and my colleagues will come around with the microphones. So if you can raise your hand. Any questions or comments, thoughts, reactions? Yes, please, the gentleman in front here.
Thank you. My name is Paul Zimmerman. My wife and I lived in Kenya for 3 years in the late 90s. I was the accompanying spouse on that venture. I would like to ask the panel for some specific local actions regarding attacking problems using the principles that you enunciated.
And let's take another question or 2.
Hello. Sorry, I have a bad cough. My name is Deborah Dekvile, and I just have 2 quick questions. First of all, I was just wondering if over the course of the project you've also seen any changes in rates of malnutrition. I don't know if that's something that you're also measuring and looking at with the changes in the agricultural practices. And then also, I was wondering if you could talk a little bit more. I didn't hear that much about the economic livelihoods aspect of the project.
Hi, I'm Robert Engelman with the World Watch Institute, and I came a little late, so apologies if this question was dealt with. Just say it has been. But I've been in a project that will be presented here next week relating to looking at scientific or peer-reviewed research documenting connections between family planning and environmental conservation and sustainability. And one of the areas that we had trouble finding good documentation for was specifically whether or how family planning as a practice facilitated women's capacity to improve their income generation, improve their status, improve their relations with their spouses, whether there was something about that practice in particular, whether for spacing or limiting, that actually produced very specific benefits. And I wonder if in the documentation of HoPE LVB, you've either through focus groups or just talking to your participants, the people in the project, or in any kind of quantitative or empirical way, you were able to document that family planning as a practice actually contributed directly to particularly the improvement in women's status, and then perhaps through that to their greater capacity to engage in environmental conservation. Thanks.
Mm-hmm. Great. So I think let's just open it up to the panel, and you can address any one of those questions that you would like. And I would also just add one final question before we get to Paula. And my question for you is, Now that you look back and you talk about a very purposeful, intentional process of thinking of scaling up from the start, what is it that you have learned that you know now that you wish you knew when you started? What do you know now? You say, man, if I knew that 3.5 years ago when I started, that would have really made a difference. So let's open it up to you, and you have a few questions in front of you. And please, anyone who would like to start.
I would like to start with the first question that was asking for specific problems that the project is trying to address in the Lake region, especially in Kenya. And I want to start by referring to what my colleague talked about the model, the HoPE approach as it began. And it began with involving all the stakeholders, the community, the policymakers, and all the other people that are involved or are affected by our interventions or who are in the areas that where we work. And based on that, most of our interventions were called based on collective understanding of all the people who are in that area, especially the community. And some of the immediate problems that are facing the community in the Lake region is, one of them is overfishing, as one of my colleagues had talked about. And the project is deliberately targeting that by sensitizing the community, especially the fishers, to protect those areas where the fish breed, the fish breeding areas, so that the fish can grow to maturity. Also, one of the problems is the cutting down of trees, the deforestation in the area in the Lake region, which the project is tackling by empowering communities with information to plant more trees to increase the tree cover. And more importantly, about that area is the issue of access to reproductive health services, and especially the family planning, which the project is also taking care of in terms of giving information, training health service providers, training community health volunteers, so that the women can have access to reproductive health services. Thank you.
Thank you. I will respond to the gentleman who asked about whether we are tracking or measuring malnutrition then or agriculture, and he did not hear economic livelihood. These are good questions, and we implement intervention that directly contribute to nutrition statuses of the households, and also in terms of messages and capacity, we incorporate those, including the types of the crops they grow, the feeding diet mechanism at household level. And as I told you, the model household aspect where one learns from the other, the kitchen gardens and the vegetables, and these are actually consumed by the home, but maybe something we don't directly track the quantitatively the malnutrition aspects, but qualitatively we capture that. Then agricultural aspects, we have got good indicators on, because one of the key interventions under E is sustainable agriculture. So we do measure crop yields, we measure the changes in the soil fertility, because we have aspects of conservation agriculture. So we are very much tracking it in that, especially its contribution to how secure the household are in terms of the food and actual incomes from the sale of the excess. Then economic livelihood, these are very critical. We even have indicators that track sources of incomes from sustainable or environmental friendly activities. So we promote ecosystem-based livelihoods like apiary, the beekeeping, and others, like we have women groups that are in the villages all over trying to form the association, and they are selling, constructing energy saving stoves and giving some monies in return. Some of them are engaged in the nursery trees, and they are selling trees for planting, for crop, and then for cash crops and food crops and fruit trees. Then also we have a number of women, young mothers who are engaged in income generating activities like soap making, and they are earning money, and most of these are within what we call savings and the loan associations. So we have them all over the place. Some of them borrow money to invest in the recommended GRs for fishing. Others invest in fees and others school fees. Others invest in other aspects. And then the dynamics of that, they don't only talk about money, but also health, issues concerning their health, issues concerning their child spacing, and all these within those meetings. So that is a very key aspect. Then I can also answer Roger Marker's question about what is it that now you think you would do different. This came out in terms of the choices of our scope, our operating areas, our sites, because our primary focus, we are targeting the hard-to-reach communities. So these are the island communities, offshores, and you have to go through the water, and these are isolated and almost with no government services, and we have tested this and it works. So at the time of scaling up, when we approach some folks and potentially they say, but you seem to be working in the lake, and maybe our focus is within the semi-arid areas or Turkana or Karamoja region with the pastoralists, and we are repackaging the information because this can be applied everywhere in different ecosystems. And that has been some of the issues. But what is the good news is that the government instead preferred to test it in the mainland, not within the island, so that we do comparison. I think that was an issue that needs a lot of clarity when we are talking to people. So even here in the room, when we say Lake Victoria Basin, most people might think, oh, this is a lake pilot, so we can only scale it. But it works in all other ecosystems. I think that was something that we thought maybe we would do in the start. But it was because of the choice of the hard to reach, and that was the key aspect.
Great, thank you. Let's take a couple more minutes so that we can get to Paula.
Dora, do you want to respond to the FP question, or?
Okay, yeah. Let me give Kara an opportunity.
Okay, sorry,
Kara, please.
Hello?
Yes.
Okay. Yes, thank you, Laura. Like I mentioned earlier, my name is Caroline Naroga. I do monitoring and evaluation for HoPE project. My response is going to be in response to the question on research about how family planning facilitated women's capacity to facilitate relationships with their spouses, livelihoods, and economic empowerment, and what HoPE has done as regards to that. HoPE has been involved in various researches right from the beginning. Like we mentioned, we did the scoping as well as the baseline study, which was a highly regressive study that looked at both qualitative and quantitative aspects of the project. So we're able to get baseline numbers as well as qualitative approaches about how women were involved in terms of family planning, their knowledge, perceptions, and their attitudes towards it, and also their economic aspects. So we also did a midterm at the end of phase 1 that looked at, that was mainly qualitative, and this was also used in relation to the monitoring data that we're capturing on family planning and economic livelihoods. So we were able to map and be able to triangulate and show that women were able to report qualitatively that through their acceptance of family planning, they're able to become stronger and they're able to be more healthier in terms of spacing their children. And so they're able to get involved in more economic income generating activities that are environmentally friendly. And this in turn has improved their household income, which has improved their relationships with their spouses, as in now they're able to provide for their homes. So one of the focus group discussions, a woman said that she reported reduced domestic violence because now they don't have to go into fights on who provides what, because she now has the money through her income generating activity like selling of soap, and also the proceeds she gets from selling her agriculture produce. She's able to provide school fees for her children, as well as basic needs, which before she relied solely on her partner, and when he didn't have them, they used to have quarrels. So we have evidence to that, and we can share with you, if you like, on our midterm qualitative assessment. Thank you.
I would also like to add on the first question, which was asking about the actions specifically taken by the projects in Kenya. The project has improved access to information, especially to our community groups. As compared to sectoral approaches, the integrated approach brought closer home the Ministry of Fisheries, the Ministry of Agriculture, where previously the communities were supposed to go to them and get information, especially when it is planting season. The people have to go and find out which is the resistant crops that we need to plant in this season. And like that happened before, right now we have been able to integrate all the sectoral offices, and our approaches, especially during our community dialogues, is to ensure that all the sectors are represented in such discussions. So when we are having an integrated community dialogue, the Ministry of Fisheries, who were previously seen when in any arrival at the fisheries or at the landing sites, were seen as enemies, because whenever they arrived, they were there to confiscate nets and arrest people. Right now, we are meeting with them to discuss issues affecting fisheries. The communities are accessing information about the planting season, the crops to plant, and when to harvest. And this has brought out better results in terms of food security, and also for the fishermen yielding better results from their fisheries activities. Thank you.
Thank you. Pamela, any thoughts?
Yes. I'd like to comment on what we've learned now, which we wish we had known 3 years ago. I do a lot of advocacy with government at the national and regional. And truthfully, once we were able to convince them that PHE was a very good approach to achieve sustainable development, the expectations. As we speak, the Memorandum of Understanding between Pathfinder International and the East African Community Lake Victoria Basin Commission is being reviewed. They're actually putting an addendum to it. And they'd like to see us work not just in Kenya and Uganda, but they would like to see us work in Rwanda, in Burundi, in Tanzania. Southern Sudan just came on board. So we're talking about 6 countries. And they want to see us work not just in the Lake Victoria Basin ecosystem, they'd like to see us do PHE outside of that. They're talking urban PHE. So we have some incredible expectations. And also, this whole process of working with government, given the institutional bureaucracy within each and the protocols and so forth, takes time. So I spend an incredible amount of time, my colleagues Sono and Laura know this, attending meetings, some in Nairobi, some actually in Kisumu, assisting them and working with them as they think through how to proceed.
Thank you. Anthony, any thoughts from you? Anthony, anything you would like to add?
No, something you guys talk about.
Okay, let me, as he's getting it ready here, because one of the, maybe some important note to take is with PHE, for instance, in our HoPE LVB approach, we find that there are many results that come along, and most of these are positive results, but not intended from start. And when we talk about tracking, sometimes you get so many things that come along as an effect or within the result chain that there are so many results and good results that you didn't intend. Like we have got a number of gender-related issues which we didn't think about from start, and maybe we thought maybe we needed even to go back and redesign so that this one comes out. And we try to report on them qualitatively, but even maybe some quantitative measures and the behavior changes. And there are even other areas of development related, like road construction. For instance, in one of our communities, a sub-county is at a local level with many villages. The farmers, because of this conservation agriculture, grew a lot of crops, some for eating, but they needed to sell them off, and the roads were too bad. So for the first time, the truck that built a road crossed the lake to the other side of the island, and the communities were able to see the car for the first time. And it was because of the constructive engagement of the farmer groups. They engaged the government and said, we don't have roads, and we want our crops to move out to the mainland so that we can sell. And these are facts, but this road construction on the road for economics, for development, we never thought about it coming up. Then there are many demanding for issues, especially on voice and accountability, that strong community movement and empowerment, which we don't even think about, but because of these constructive dialogues like campfires, the meeting, the night, women bring out issues and say we have 2 health personnel within the health center and we need 5 as per the requirements of the government. They write a letter, they engage a meeting with the national and district health workers. Around 4 of them have been upgraded from health center 2. With the 2 you have, of course, these are islanders and you have many people demanding, but you don't have the required services. So they have to upgrade you so that they give you the appropriate slot of supplies that are required. So when you are on 2, you get less. When you are upgraded, so these are dynamics that we don't even think about. I remember, I think in HoPE, where they have given the government has done electricity, I think, in the health facility. And these are community movements. We are not there. They sit in there in dialogues in the night and during the day. They engage the government and also strengthen the monitoring mechanisms for accountability of the health service facilities so that the drugs are there, there are less stockouts, and they are given to the people. People can always access them anytime. So these are many, many benefits. That's why when we came up with mapping the linkages with our project and SDG, it almost cut across most of the targets within. It looks a bit ambitious, but also the SDG are ambitious plans. So the implementation is still open. So we need to look at promising approaches like a PHE approaches or HoPE LVB model that can help multi-sector benefits to accomplish or benefit or attain the ambitious plan. So the approach is ambitious and the targets are ambitious. So I think there is a balance.
Thank you.
Thank you. Anything else to add? Well,
Yeah.
We're going to have lots of time for questions coming up. So is it okay for you to hold it for now? Is that all right?
It's just
Okay.
something that the group would disband, and it's on integration, and I think it affects all of us.
Great, but we'll come back to it. So I'm really thrilled that we have an opportunity to also have a conversation with Paula Caballero, who is the Senior Director of the Environment and Natural Resources Global Practice at the World Bank. And in my conversations with Paula, we have very often talked about integration. So she very much has supported integration at various levels in a lot of the work that she has done internationally, in Colombia, where she's from, and at the World Bank. And when I told her about our discussion today, she immediately replied, yes, I would love to be part of this, because the World Bank is doing work in the Lake Victoria Basin and seeing that that Paula understands integration so well. It was such a wonderful opportunity to contextualize this work that we're hearing from our partners here with some of what Paula and her colleagues is doing. So previously, she served as the Director for Economic, Social, and Environmental Affairs at the Ministry of Foreign Affairs of Colombia, and she managed the team responsible for formulating foreign policy on a broad range of sustainable development issues, including climate change, biodiversity, land degradation, fisheries, agriculture, and transboundary systems, working closely with a wide array of national and international partners. A leading voice and negotiator in the international fora, including the UN Framework Convention on Climate Change and the post-2015 framework, and was actually quite instrumental in the whole SDG process. So Paula, it's a pleasure to have you here. Welcome, and I hand it over to you.
Thank you very much, Roger Mark, and thanks to everybody for this opportunity. I have to say that it was really, I was really struck when I started to read all of the background material. And as I read it, I just felt increasingly very privileged to be able to join you here today to learn more about this initiative and to have really an opportunity to talk about this. The World Bank sounds like a really big institution, but we cannot do any of this on our own. And it's really through partnerships and through innovation, as we're seeing here today, that we can really start to make use and really incentivize these new frameworks that we have agreed to. So let me just start off by saying that there's a sentence in one of these documents that says that taking a systematic approach to designing and implementing in ways that look ahead to sustainability and future scaling up is itself an innovation. And I would correct that. I would say that it's a revolution. And I would also say that I wish we had been able to have this panel when we were negotiating the SDGs. Because the SDGs now seem like a really obvious thing, and they're a fact of life, and they're the cornerstone or the linchpin of the new development agenda. But it was an uphill battle for many years to try to get these even accepted. It was initially seen as something that was somehow against the MDGs, that was undermining what had been agreed to. That was too complicated, and there were also suggestions that we should have a framework for poor countries and a framework for rich countries to maintain that divide. So it was really, really complicated from both a technical and a political perspective. And I think that if we were to have heard the kind of benefits and the kind of positive trade-offs and synergies that we've heard today, it really would have done, and I don't say this lightly, a huge contribution to allaying a lot of the fears and the concerns about what integration means. So I also want to say that I was very struck because I joined the bank 2 years ago, and from the beginning I told my entire global team, you are prescribed for using the word pilots. We don't pilot anything. What we need is proof of concept. And then I see these papers, and they're saying exactly the same things. And it's because that pilot has that small mentality of something finite, something that will land. And proof of concept has implicit in it the sense of, okay, how are we going to take this forward? Where are we going with this? So let me start off. I'd like to just maybe touch on, I'm not really sure how much time I have, but I'd rather than speak a lot, have a time for also continuing the interaction that I know you want to have with the other panel members, because I sense, Roger, Mark, in the room that there were a lot of other questions. So I'd just like to hit on a few considerations, if you will, and that we can unpack further. So the first is sort of the big picture. When we were struggling with trying to get the SDGs accepted, and to really trying to understand how integration mattered. A lot of the examples I always gave came from the health sector, right? If you want to really continue to make a dent on maternal mortality, that's not a standalone goal somewhere. You need an entire system, a health system, you need roads, you need energy, you need education, you need capacity. You need so many things in order to be able to, for example, help that woman deliver that baby in a difficult situation. It's not just an isolated target. When we were talking about malnutrition, I was always saying the moment the revolution comes, not when we change entirely our definition of malnutrition. It is when that target on tackling childhood malnutrition becomes a target that is owned by the entire government. That it's seen that the Ministry of Planning, the Ministry of Economics, that the Ministries of Agriculture are understanding, oh my gosh, this is our human capital for the next 20 years. This is what this country is going to look like. And that will change the conversation about malnutrition. So you have the same target, but just this fact of this ownership, which is what I've been hearing today so strongly, this sense of an ownership across sectors, an ownership across these silos, and an ownership of results, which is coming so powerfully from what I heard from you. And I'm sorry I arrived late, but what I heard was, and what I've read is already very powerful. It is that what changes. And I think also one of the big challenges right now for this whole post-2030 agenda, the 2030 agenda as it's now called, is how do you finance it? And again, I think the health sector has led the way. You look at Gavi, right, the Global Alliance for Vaccination, and that was really an initiative that was unique in that it brought together all these different partners that we talk about. We have very contentious conversations about how you engage private finance in supporting the SDGs, in a sense that somehow that means that the contributions that developed countries have committed to will not be forthcoming. Gavi showed it doesn't have to be that way, that where you really have an understanding of what are the impacts and the results that you want to have, you can galvanize these amazing coalitions that go far beyond. Financial resources are important, but go far beyond that in order to deliver on these new agendas. And Gavi really showed the way. And when we talk about financing and financing for development, I often look to Gavi again to show the way forward. So in so many ways, the fact that this is such a beautiful combination of health, of environment and population dynamics is really important. And I really want to highlight what you said at the end, that you're already hitting all the SDG targets. And I would say, yes, of course you are. Because when you actually, what you've changed isn't just the approach, you've changed the entire mindset of how you approach development. It is about doing development differently, and almost organically, you end up hitting all the targets. So let me move to a next set of concerns. So this is sort of the big picture, right, of why all of this is so incredibly important, and why what you have here today is really sort of a revolution in a nutshell that needs to be expanded and upgraded. But before I move a little bit, and I'd like to dig a little bit more on this value added, the fact of this sort of organic benefits that arise when you change the mindset. Just also want to say that it's really important that you're also engaging in family planning and population, because oftentimes, or most of the times, good part of the time, that's I don't know if the big elephant in the room is an appropriate metaphor. Maybe we can think of something else big sitting in the room, but it's a huge issue that in international spaces, within the UN, or oftentimes even within the World Bank, it's just not a space that we can readily engage in. And projects like this that show that you can and you need to include this dimension in such an incredibly productive way, in such an incredibly constructive way, in such an incredibly depolitized way, is going to be fundamental, because that is a revolution that still has to happen within the UN system, within the World Bank, within a lot of the multilaterals. So I think that that's also something that I would really highlight in terms of the big picture of the great work that you're really doing here. Let me come back to the second point I wanted to make, which is really about that value added. And one of the concerns that I hear a lot is, and Roger, Mark, just tell me when you want me to wind down and I'll cut off.
Keep going.
Okay. When we talk about these, oh my gosh, it's 169 targets, it's like, and my reaction is, but yes, and 17 goals. Well, yes, but development is complicated. That's really what it looks like. And let me give you a sweet little anecdote. There was Ban Ki-moon created a high-level panel to provide inputs to this whole process. And this high-level panel was 23 eminent person and a few others. And they really were people that did not have necessarily a huge hidden political agenda. You know, you had people, amazing people, one of my particular heroes, Paul Pullman from Unilever. We had Queen Rania of Jordania, whom I really came to respect for the work that she's doing on education and her active engagement with youth and how knowledgeable she is. We had Ngozi, whose last name is right now escaping me, former finance minister of Nigeria. You know, these were heavy-duty thinkers. And guess how many goals we ended up with? The real story. Wild guess.
36.
No, I mean, we ended up with 16.
60.
But if you read the high-level report, you'll only see 12, because that, at the end of the day, it didn't look nice. There was all this last-minute back and forth, and so it got down to 12. And so if you look at the HLP report, there's 12 goals, and it's like a dozen, and it's sort of a dozen is sort of nice. But look at what's missing. There's no goal on cities. There's no goal on ocean. So these huge agendas got left out. We got 12, but we didn't get cities, we didn't get et cetera, et cetera. So the point I'm trying to make is if a group of eminent people sitting quietly in various places around the world with amazing advisors sit there and try to tackle this agenda and figure out, okay, what would this framework look like? And they end up with 16, in all honesty, not 12, 16. 17 coming out of this massive intergovernmental process that was the most participatory ever in the history of the UN, comes up with 17. Sorry, I call that a miracle, like a full-grown absolute miracle. So this is great, because when they say, oh, and 169 targets, and I go, yeah, but that's a miracle, I would love to have you in the room with me to explain why it's a doable miracle, why it's not just this extraterrestrial miracle that cannot be done. It can be done, it's easy, and once you start to manage it and understand and evidence those linkages, you actually lower the transaction costs. It's actually cost effective. So a lot of the conversations, you know, another one of the things or the initiatives I really admire is the New Climate Economy. And what they're doing is trying to demonstrate that actually green growth, so to speak, is cost effective, or that the marginal cost of, for example, higher upfront costs is so marginal comparison to the long-term benefits that it's worth it. And that's exactly the argument that we have to make here, that yes, there might be sometimes a few higher upfront or different kinds of costs or different ways of needing to look at the reporting and the monitoring, but the long-term costs are incredible. And I think a lot of what Dora was highlighting of these efficiencies and the linkages, the way that men have been involved, all these unexpected, amazing breakthroughs that are really changing behavior and that are really changing mindsets. Because this isn't just about changing economies, it's about changing mindsets. And that's what this project is doing from the ground up. That is so incredibly powerful. And that is what we need to demonstrate that, hey, 169, yes, we can. And hello, you hit on how many of them? Almost 169, right? Without trying. so that's really huge. Another aspect of that value added is the bottom-up empowerment, right? And I'll talk a little bit about scales, because at the bank, obviously, we tend to operate at different scales and sometimes bigger scales. But this idea of really bottom-up empowerment is really powerful. And I think that what you've described today is something that I have witnessed with a lot of community-based projects we have at the bank, and that is that when people are given an opportunity, it just unleashes potential. It unleashes entrepreneurs. Last time I was in Lake Victoria, I'll talk a little tiny bit about the project that we have there. And we were visiting one of the many small-scale projects that we have within this big project. And it was an aquaculture project, and you know, it was this fish pond, and they showed me the fish pond, and everybody was very proud and happy of the fish pond. But they kept pulling at me and saying, no, come, I've got to show you this. And so I allowed myself, and there wasn't a fish pond, there were like 3 or 4 other fish ponds that they had started to build on their own. So the World Bank investment, this fish pond, had already been multiplied. They were already managing the lakeside in front of, well, in the space that they were controlling, much better. There was a real sense of empowerment. Exactly, I heard an echo so much of everything that you were talking about. It was really incredible. So at that point you start to say, excuse me, what transaction cost was it that you were talking about? Why is this more complicated? And it's not, right? It is, but it is not. So I think that that's something that's very powerful. from a global perspective, that projects such as these would need to be evidenced. Another great, and you had a brochure here that I was seeing, and I thought, because I had already highlighted that, is this thing of, how do you call it? I had written it down, beginning with the end in mind. And that is another revolution. That's the backcasting, right? It's understanding that we've gotten ourselves into this huge mess that we've gotten ourselves into globally, because I think we have done, because we've just sort of made incremental progress. So a few have benefited, we've done this, we've developed. We've never really started to look of what it's going to look like when we get there, what the synergies, what the trade-offs are. It's the short-term incremental approach, and that's how we've done development. It's very opportunistic, it's completely ad hoc. And where we are now, we're not going to get ourselves out of this situation through the same approach, right? So backcasting to me is very powerful, and it's exactly what you're talking about. Okay, where do you want to be in 2050? Where do you want to be in 2100, in 2100? I always say to my team and to others, if you want to talk about agricultural yields in the next 2 or 3 years, by all means go talk to ag. If you want to talk about agricultural productivity in 2050, come talk to me, because that's what we're thinking about. That's what environment, right? Natural resource. That's what we do, is try to look at that long-term complexity and figure out, okay, if this is where we want to get to, what do we need to change going back? And that's exactly what you have. It's exactly, and I don't know if I could just give you so you understand the hugeness, I think, of this. It's very much the work that needs to be done now under the Paris Agreement to deliver on, well, 1.5, let's say 2, let's aim for 3, whatever degrees that we will ultimately end up. And the Paris Agreement calls for, or consolidates what was agreed in Warsaw, which is that all the countries will have their nationally determined contributions, right? What they will do in mitigation, but G77 was very successful in saying, and adaptation. So what are you going to do in terms of delivering on that? But the Paris Agreement also has something very important. It calls for countries to develop long-term strategies. And what I say is that we have to, at the bank, we have to work with countries so that we don't have, and the Paris Agreement also has a sense of an upward spiral of ambition, right? So every 5 years, countries will submit or upgrade their nationally determined contributions in a way that shows even more ambition, because everybody knows that what we're doing now is insufficient to tackle climate change, so every time we'll do more. But what I fear is, again, that we'll do a little bit more, and then a little bit more, and maybe that little bit more that we did here wasn't really so hot because it's back. So we have to start here with those long-term strategies, right? Where does this country want to be in terms of its urban infrastructure, in terms of its water management, et cetera, et cetera? Where does it want to be in 2050 or 2070 or 2100, right? Where does it want to be? And what kind of planning processes are needed? What kind of nationally determined contributions are needed to get it on that pathway? And that's exactly what you are doing here. And that's why this is also so incredibly powerful. And I use the example of the Paris Agreement because I think it's really what you're doing here has enormous potential and enormous application. And for all of you who are scholars or experts in this room, really the work that is being done here has to be mined and understood and analyzed from that much greater perspective to give fodder, to give ammunition to those who argue for the same incrementalism. So this, I think, is something I really wanted to highlight. It also is the only way that we're really going to be able to enhance communities' coping range. Resilience is not something that we are going to be able to build in a little bit, bit by bit, opportunistically. It really is. If we're going to really try to enhance coping ranges, you can only do that with that long-term vision, right? So beginning with the end in mind, it sounds like the most beautiful poetry. It sounds like something T.S. Eliot or somebody else would have said, but it's also the reality of how we can turn. So you really have hit on some of the big ticket items, right? The benefits of integration, the logic of that backcasting. This is a profoundly transformative project on many ways. So those were my thoughts that I wanted to share with you on what you're doing. Let me very briefly say what we're doing, but it's really quite a lot less ambitious and revolutionary than what you're doing, but let me share it. So we have a regional project called the Lake Victoria Environment Management Project, which is now in its second phase, which speaks to, you were using the word patience. That's what it takes. You can't do this. And one of the problems is that we have to get over that short-termism, right? The project cycle, the election cycle, the budget cycle, the whatever cycle. That's not how transformation works. So how do you build in that appetite for hanging in there? And that's what this project is also. I mean, I could keep talking about amazing things you're doing, but that's something else you do. You're creating an appetite and a capacity for that staying power. So anyways, we've been able to have some staying power. We now have additional finance. It started off with Kenya, Tanzania, and Uganda, and then we added Rwanda and Burundi. So we have the entire watershed. We started in 2009, and it's going through 2017, and hopefully we'll be able to start to have appetite for a third phase. You all know the situation in Lake Victoria, declining fish stocks, greatest freshwater fisheries in the world, declining, et cetera, high population density, high poverty rates. And I also think that what we do in Lake Victoria or don't do will have enormous replication and demonstrative value, for example, for Lake Chad, which I really think is one of the biggest development challenges we have on our hands right now. So again, a lot can be seen to be writing in terms of replication potential of what you're doing here. We've been working on different elements. One is management of shared lake resources. So, and this is something that is where I think it's the value added of the bank, right, to work at that bigger scale. So harmonized policies on water resources, fisheries management, effluent standards have been developed. We're updating a regional fisheries management plan, but it's very good to have that kind of advocacy and bottom-up support that this project and that all of you working on this project can have. We've also been looking at community-based biological or manual control of the water hyacinth, and we're working on more than 30 shoreline hotspots. We also have supplied to Kenya a mechanical harvester, so it's really looking at different approaches to deal with invasives. And a capacity building program has begun for emergency spill responses. So this is sort of at a global level. We've also been working on modeling and monitoring at a basin-wide level, which is absolutely necessary if we're really going to understand the dynamics. And we have an important part of the project is we have a series of community-based initiatives that, the aquaculture I gave you was one example. There's lots of other examples, but also working very much with private sector. So we have a component of the project that's looking at cleaner production. So working, for example, with a brewery to demonstrate the possibility for having much better pollution control in industrial. It's not an industrial estate. We're starting small, but demonstrating, and also investments in sanitation. So it's a far-reaching project. It's one of those big bank projects. We're also trying to work very closely. There's other bank projects in Lake Victoria on transport, et cetera. So making an effort to work across the silos within the bank. We also, like governments, tend to have silos. So how do you work across those silos? But more than just the nuts and bolts of the project, which I don't think is, and I can send you linkages if you want to find out more about it. But I think it's more productive to talk about some of the future priorities that we see. One is really to continue that conversation around sustainability, the narrative sustainability, what it means, what it translates into, and why really, for example, environmental sustainability has nothing to do with environment. It's actually about people, and if you don't manage the environment, people will suffer. And it sounds obvious, I see nodding around the room, but you go try and explain that sometimes out there, it's pretty hard. Environment is not, about mermaids, like I say, it's really about people. Sometimes you would think it's about, some obscure things. It's about scale, and that's where I think it's important to look at understanding the different entry points at scale and linking up between scales. So just as we have community-based projects and then we have these projects at a basin level, we're also very keen to partner with the likes of you to really see where we can leverage each other. As I said at the beginning, the World Bank sounds like this big thing, but we have limited resources at the end of the day, given what needs to be done, and it's small teams, really dedicated, amazing people. But, you know, if we can partner, we can do a lot more. There's another challenge when you start working at a regional level, is that you start to see that there's very different environmental priorities or different kinds of priorities between countries. So how you manage that and the timescales of what countries are ready to do what when also varies. So that's one of the challenges we've faced in the project in terms of both political processes, technical capacity, different priorities that have been set. So really the synchronizing the different components. The synergies with the private sector is one where we really want to do a lot more work. As I mentioned, clean production, but there's enormous opportunities also with sustainable supply chains. And mind you, when I say private sector, I'm not talking about Unilever. It's everybody. It's that small entrepreneurial fisherman that you were describing, who goes home and now his kids aren't screaming. That's private sector. Fisheries management at different scales is also something that we need to do more, because it's very different it's very difficult to monitor, it's costly to monitor, but if there's more engagement bottom up, then it becomes much easier and far more organic. And to really see things like exploiting tourism potential, I think that there's other sectors where there's opportunities that are untapped or that could be strengthened. So we see Lake Victoria as a place of enormous potential, huge challenges, enormous potential, but one where we really are committed to continuing to work, and very privileged to hear about what others are doing. Thank you.
Thank you very much, Paul. I think that was excellent contextualization for us. So talking about appetite, it's time for lunch. So what I'd like to do, we have about an hour left for our program. I'd ask you to step out, grab your lunch, and come back in as soon as possible. We'll use a little bit of this time for networking. Some of you may want to chat with Paula a little bit as you grab your lunch. And our colleagues from the field, one of them will sit at the tables, and you'll have an informal discussion over lunch. So there's an opportunity for you to interact with them one-on-one, and then we'll debrief as we wrap up. So please step out, grab your lunch, make some connections, and have a discussion at your tables, and we'll provide some thoughts on things you could talk about as you chat over lunch. Thank you.